Hey, sounds good. Well, first and foremost, it's great to see everybody. We're honored to be back to help present on our substance use resources as funded by the department. I'm really thrilled to have two of my key team members with me that will be doing our part of the presentation. Assistant Commissioner Taryn Sloss. She's our AC for our Division of Substance Abuse Services and has been providing leadership for substance use services in Tennessee for decades. She'll be joining me, as will Jessica Youngbloom, who's our Director of Strategic Initiatives, and who's done some just a really amazing work, innovative work, relevant to strategic initiatives specific to substance use. So they'll help me with the presentation. We're going to cover kind of at a high level everything that we do, or at least key things that we do across our prevention programs, harm reduction, treatment, as well as recovery support. And I'll tell you, each of those things are equally important. Again, Paula, Wendy, Jennifer, appreciate what y'all are doing, y'all's continued advocacy on this topic. I've learned a lot just from participating in these sessions, and I know on the resource page that will be disseminated, it talks a lot about the intersection between traumatic brain injury and substance use disorder, and the stats are pretty notable. People with TBI are 10% more likely to die from accidental overdose. Within 8 to 12 months of a traumatic brain injury, 10 to 20% will develop a substance use disorder, and then approximately one half of all people receiving substance use treatment have at least one brain injury. So the intersection is pretty common. So anyway, we'll go ahead and get started on this. Jess is going to help me progress through the slides. Jess, if you want to go to the next slide. We always start any presentation we do just providing a foundation as far as who we are as a department. This is our mission and our vision. One of the things I always point out is that term collaborative pathways. So everything that you hear about today from our department is done through collaborative partnerships with entities across the state. These are prevention coalitions, these are substance use treatment providers, addiction recovery program providers, housing providers. We cannot ensure these pathways to resiliency, recovery, and independence without collaborative partnerships. We don't accomplish our mission without our provider network. You can see this, our vision, a state of resiliency, recovery, and independence in which Tennesseans living with behavioral health conditions thrive. That word is important to us. It's not about just supporting someone so that they can exist in their community, but truly thrive in the community in which they live. Here's our department budget. We have been so fortunate in recent years to receive considerable funds from the administration, from the legislature. You can see how our dollars across the department are invested, and 94.5% go directly to services, and that's a point of pride for us. We have one of the lowest overheads of any state entity. You can see the breakdown of that $576 million. 229 goes into community mental health, 168 million to our regional mental health institutes, of which there are 4, and then almost 30% go into community substance abuse services. We're really proud, at least I'm proud, because I oversee our community mental health and community substance abuse work, and you can see the bulk of our funds go into the community, and that's where we think people can best be served for certain. Wanted to provide some landscape about the data, prevalence data rather, related to substance use disorder. Like, how big of an issue is this? I think we all can attest it is a big issue, and it's a growing issue. You can see it based on SAMHSA data, crosswalk with census data. And again, these are just estimates. In 2021, of people in our state ages 18 and over, we estimate about 1.1 million are living with a substance use disorder. This pie chart here, I think, is really important to note because it breaks down of that 1.1 million, who's responsible for the treatment of those individuals. And you can see we estimate about 34% are covered through public insurance. I know our partners from the managed care organizations are here today. They'll be talking about the work that they're doing. We estimate about 53% are covered through private insurance or commercial plans. And then the slice of this pie that we are focused on as a department are uninsured Tennesseans. And we estimate 132,000, of which we served a little over 20,000 in FY22. All of this to say, there's about 20% of people in our state that are living with a substance use disorder. And this has increased dramatically just in the past 2 years. I think previously it hovered around 8-9%. Now we're closer to 20%. So we've seen significant increases in SUD. This is specific to young adults, adolescents, ages 12 to 17, 61,000 across our state. The percentage is a little less, it's 11%, but you can see here the breakdown across payer sources and how that amounts to the 61,000 that we estimate having a substance use disorder ages 12 to 17. So at this point, I'm going to turn it over to Taryn to really walk through. I know we don't have too much time, so she'll speed through these, but wanted to provide everyone an understanding of what we do with our continuum of care, our prevention programs, and how to access those services. So Taryn, I'll turn it over to you.
Awesome. Thank you, Matt. Hello, everyone. Taryn Sloss and Matt. Love to try to, make a little point to my age, but he keeps forgetting that I started doing this when I was 18. So decades, you got to add 18 plus a couple of decades. So anyway, thanks so much. So the Division of Substance Abuse Services is responsible for the state's effort to prevent and treat substance use disorders for individuals who are indigent and do not have the financial means to obtain those services. We provide our clinical treatment services through what we call the continuum of care. The continuum of care ranges from outpatient to detox services that are provided by our community partners. There are 37 across the state. Many of those community partners also offer medication-assisted treatment. They basically offer buprenorphine and Vivitrol. We contract with opioid treatment programs for methadone. And then we just recently started off in Sublocade, which is an injectable form of Suboxone. So over the last fiscal year, 2022, more than 20,000 individuals received treatment and recovery services through our community partners. Next. Thank you. So we provide resources to individuals through 4 main program areas. Prevention, as you can see, those are the community-based coalitions and Tennessee Prevention Network. They offer services that are more primary prevention focused. So those are individuals who are at risk for substance use disorder. The next focus area is treatment, and which we just talked about just recently on the previous screen. Next area is the addiction recovery program. With addiction services, we are really excited that we've had the opportunity to expand our transitional housing and recovery houses. Our Oxford House, we have about 145 of those statewide. And through our Creative Homes initiative, we have increased housing for individuals who have an opioid use disorder and also those individuals who are re-entering from the criminal justice system. And if I'm not mistaken, this fiscal year, they'll be working on providing housing for those individuals who have SMI, MPI, who re-entering back into the community. And the fourth focused area is the Criminal Justice Services Division. And we do DUI schools. So we are the people who license DUI schools, and they use the Prime for Life curriculum. And a little bit later, I'll talk about recovery courts and criminal justice services. Next. So as we were talking about prevention, one of our primary programs right now is the Regional Overdose Prevention Specialists. Those individuals focus on training and education, which includes opioid use disorder, overdose crisis, stigma, and how to use naloxone. These individuals serve as our point of contact for naloxone distribution. They also work in the community in the event there's an overdose spike or if there's a clinic closure. They raise awareness and reduce the stigma of overdose epidemic and available resources. Next. Here's a map of where the regional overdose prevention specialists are located. There are 20 to 24 ropes in total statewide, located in 13 regional divisions. And you can just go to our website to find out about the ropes that's located in your area. Next. So overdoses are increasing at an exponential rate as a result of fentanyl. As you can see from this chart, in 2015, there were 169 overdose deaths involving fentanyl. And in 2021, it increased to 2,734. We understand from the Department of Health that the 22 data will be available towards the end of this fiscal year, or this calendar year, rather. So the goal is to reduce overdose deaths, our goal, and to empower people to make safer decisions. So last fiscal year, the legislature passed a law to allow the use of fentanyl test strips. During last fiscal year, we distributed 126,000 fentanyl test strips. In the first year of this effort, the department collected voluntary data submissions from people who use fentanyl test strips. And according to those individuals who took the survey, 84% have implemented at least one positive life-saving behavioral change. A behavior change could be that they had naloxone with them or they used their product differently. Next. So the Tennessee Save a Life is the name of our opioid overdose education and naloxone distribution program. As you can see, the ropes have been very, very busy over the last several years. They've trained over 450,000 Tennesseans on outreach and education. They have distributed 490,000 units of naloxone, and there have been 66,000 successful overdose reversals reported as a result of this naloxone distribution. Next. Just to briefly touch on xylazine. Xylazine, you may have heard about it, is an emerging trend, and it is a veterinary tranquilizer and it's not approved for human use. So what we're seeing is that nalazine is being used in conjunction with fentanyl. So one thing that we do know is that nalazine causes necrosis and wounds to the skin. So several or a lot of our treatment providers are seeing individuals presenting with this erosion of the skin. Also, we're using naloxone with xylazine. So what we do know, because xylazine is not a opioid, naloxone does not reverse xylazine, but when it's used in conjunction with fentanyl, there's a strong possibility that Narcan will work. So we're always advising people to utilize a Narcan. It doesn't matter whether or not you know if xylazine was presented there or not. And we're also investigating nalazine test strips, and we are trying to find out the best strips that will be available, and we're exploring those options. Next. If you want to learn more about xylazine, you can just go to our website at tn.gov, behavioral health /xylazine, and you'll see multiple resources there that you can click onto and download. Next. So addiction recovery program, the addiction recovery program is a program that we have about more than 100 agencies who are providing recovery support services across the state. As you can see listed, there are multiple activities and services that are provided through that program. And I noticed that we really want people to go through relapse prevention because we listed it twice. But these are the programs and the services that are available through our addiction recovery program. Next. And I believe, and that is me. So recovery courts. So this title says Tennessee's treatment courts, but actually We named them recovery courts because we decided that we wanted to focus on the outcome rather than the problem. So there are 82 recovery courts across the state, and we have recently increased the recovery courts with more mental health courts. Next. Criminal justice liaisons. The CJLs work directly with the local jails and court system to facilitate access for individuals with mental health or substance use disorder who come in contact with the criminal justice system due to incarceration or at risk of incarceration in order to determine what services are needed and what referrals are necessary to redirect them from jail into the court system. We have a criminal justice liaison coverage in all 95 counties. They provide linkage and referral to mental health and substance abuse treatment and recovery support services, stabilized housing, and other community support. Next.
Hey,
Oh,
Taryn, really quick, before you turn over to Jess, on the regional overdose prevention specialist, if anyone on the call here or the meeting wanted to engage with their ROPE related to a possible training for their organization, how would they do that?
So if we just go back to slide with the map on it.
Karen, I also dropped the map link in the chat while you're talking.
Thank you, Kate, who's in our department. Here, they can go to that link. At that link, they will see the contact information for the ROPE in their area.
Okay, good. I just wanted to make sure folks knew they could contact the ROPE directly. And then related to the treatment that we fund, would you say that calling the red line would be your best access point? So if anyone's working with someone who's uninsured, may have a substance use issue, calling or texting the red line would be the way to go.
Correct. Thank you, Matt.
All right, so as Matt noted, my name is Jessica Youngbloom and I serve as the Director of Strategic Initiatives for the department. The first project I want to tell you about is our Lifeline Peer Project. This is a project that is built off peers. So we use individuals in long-term recovery who have received their Certified Peer Recovery Specialist certification. Our project started with 10 Lifeline coordinators who are based across the state to provide education and support to communities around mental health and substance use disorders. So providing education and awareness around those, as well as providing infrastructure for recovery support meetings such as NA, AA, all recovery, things of that sort. We have been able to partner with the Department of Human Services to expand this to include 10 additional Lifeline coordinators who focus on our distressed rural counties. Since 2014, Lifeliners have been able to refer 26,000 people to treatment and have presented probably more than 10,000 recovery trainings and have helped create more than 750 recovery meetings across the state. And like the ropes, there is a map on the department's webpage that lists each Lifeliner. So if you'd like to learn more, you can always contact them directly or you can contact me as well. Our faith-based initiative work started back in, I want to say 2014. We knew that individuals in the South tend to go to their place of worship first when they need help with something going on in their life. And so we thought what better way than to tap into our faith institutions across the state to be able to bring services to the people coming to their places of worship. And so we have 4 faith-based coordinators that are regionally based, one for East Tennessee, one for Middle Tennessee, one for West Tennessee. And then we recently were able to bring on one specifically for Shelby County. And they partner with congregations as well as faith-based community providers to provide education to decrease stigma among the congregation, but also to help them provide resources to their communities, whether that's hosting AA meetings, providing places for people to go for support around their recovery, things of that sort. Since inception, we've certified over 1,000 congregations across the state who are certified congregations of certified recovery congregations. And then we've also been able to create a plethora of trainings such as Mental Health 101. We provide QPR trainings, things of that sort, so that we're making sure that not only are the leadership trained, but the congregation staff as well. The Tennessee Recovery Navigator Program was a program that was started in 2018, also utilizing peers in long-term recovery. We partnered with 8 community-based treatment providers across the state, and they hire individuals in long-term recovery. And then we create partnerships with hospital emergency departments. And by doing that, we're able to respond to emergency departments when our individual comes in due to a non-fatal overdose, experiencing active withdrawal, or having a substance use disorder. Our peers are able to meet with them on that peer-to-peer level and help them get connected to treatment and recovery resources. In this past fiscal year, we were able to serve 3,730 patients, with about 2/3 of them getting connected to some sort of treatment or recovery resource. And we've been able to partner with 56 hospitals across the state. This project has led to other projects and has seen a lot of growth in the past several years. Lastly, Project Rural Recovery is a project we received funding from SAMHSA for back in 2020. We were able to partner with 2 providers to implement mobile health units in 10 rural counties. That was our focus. That was our goal, was to respond to Governor Lee's first executive order on serving our distressed rural counties. Our first 2 units were able to get up and going in 2021, serving Perry, Wayne, Marshall, Lewis, Lawrence, Granger, Cott, Hancock, Jefferson, and Claiborne counties. And then just in 2023, we were awarded with ARPA dollars, thanks to Governor Lee and the General Assembly, to bring on 2 more units, covering the rest of the counties listed on that slide. The mobile units provide integrative care, so we're providing basic primary care services, kind of what you would see in an urgent care setting, along with mental health and substance use services as well. They are in each county 1 day a week and provide those services. And that is our webpage if you would like more information.
Hey, thank you, Jessica. And I would just say, if anyone's interested in learning more about any of these programs, if you go to this website, to our website, you can get a lot more information on each. I will say, Wendy, before we close out, there's a couple of themes that I hope emerge from our presentation, one of which is the value of lived experience. So I hope you can see that our department really prioritized people who have been there, done that as it relates to substance use disorder, mental illness, and they're being used in various parts of our continuum, whether it be the Lifeliners, the Tennessee Recovery Navigators. We feel like there's a lot of value in lived experience and using those individuals as an adjunct to clinical therapy. The second theme I hope everyone saw is that we are doing our best to meet people where they are. So Project Rural Recovery is one of those. Again, going to those hard to reach rural communities with resources that we know people need, the emergency departments. And the other thing that we know, unfortunately, is that a lot of individuals, as a result of having a substance use disorder, as a symptom of having a substance use disorder, there's an interface with the justice system. And I know, Tarn, we didn't have time to talk a lot about our recovery courts. I know Marie Crossan's on here somewhere. There's Marie. If you don't know a lot about Tennessee's history with the recovery court movement, it's worth taking some time to read up on. I think, is it 86 recovery courts? Now, you may have mentioned it, Tarn. I can't remember off the top of my head, but they play a really, really key role in helping divert people from the justice system who have substance use disorder and helping them find treatment. So we're really proud of that work. And Marie, thank you for your leadership on the recovery courts across the state. So Wendy, that's our presentation. We'll turn it over to our partners from the MCOs, but we'll hang out for any questions at the end.
Great, thank you so much. That was incredibly informative. Renee, I think if you're next, Renee Bentley, if you're next, you can feel free to share. And thanks to Kate Faulkner for popping all those links in the chat as you went along. That was really helpful.
Well, good afternoon, everyone. Can you hear me okay? Great.
Awesome.
Zoom started to spin when I shared when I turned on my camera, so I was a little afraid of that. So good afternoon. I'm Renee Bentley. I am the Executive Director of behavioral health here at AmeriGroup. So what I will share first with you guys, just to kind of give you a high level around TennCare, as Matt shared, there's a high percentage of folks in the presentation that are TennCare recipients. TennCare is Tennessee's managed care Medicaid program, which provides health care insurance coverage to certain groups of low-income families. Individual, which includes families, children, pregnant women, parents, caretaker, relatives of minor children, older adults, and adults with disabilities. You can learn more about the TennCare program. There'll be some information shared. There's a one-pager, I think, that is being put together for a substance use resource document that will have these links in that resource document. One thing I will share just high level is that all three of the of the managed care organizations have behavioral health services that are part of the Medicaid covered benefit. And those benefits will include routine outpatient therapy, medication management, which also includes medication assisted treatment. We heard some of that from our colleagues at the Department of Mental Health. It also includes intensive outpatient treatment services, partial hospitalization, residential treatment for substance use, and then also, of course, any type of inpatient treatment that may be needed to address those co-occurring incidents of mental health and substance use. So that all three of us will have those as covered benefits. So you'll hear my colleagues from Blue Care and United say some of the same things. For AmeriGroup, I just wanted to give you guys just a quick overview of what we have to offer within our within our organization. I always like to say there's more to managed care than authorizations and claims. We actually have clinical departments within our organizations that are made up of licensed professional counselors, social workers. I think we have some licensed marriage and family counselors. We have some RNs on our team that specialize on the psychiatric care of things. And we also have a team within our case management team that are certified peer recovery specialists. So as Matt and team has shared, the importance of just leveraging the experiences of individuals with lived experience, we find that very important too in the work that we are doing. But on our clinical team, we refer to it as behavioral health case management. And so if you have folks that are a recipient of TennCare benefits and have AmeriGroup as their managed care organization, there is a plethora of individuals and resources that are ready and able to assist. We are focusing, of course, on those members that have barriers to care, that need assistance in seeking treatment. And so you will find in this information that is going to be shared how you can get a referral to us. So if you're working with an individual that needs assistance in some way of getting connected to treatment, we can definitely assist with that. We can help address any type of social determinants of health related needs, whether it be transportation or food, whatever it may be. Our teams are trained to address those needs as well. We really just want to make sure that any barrier to care that our members experience, that we help navigate through the system. It is very difficult for our folks sometimes to know where to go when for their needed treatment. I also just want to highlight, we have a partnership you heard a lot about Redline. We have a partnership with the Redline team that if an AmeriGroup member calls into Redline for assistance, there is a warm handoff that occurs to folks on my team that can help that person as they are calling in. We want to be able to do that as in real time as possible. We also have over the years have developed a partnership with the Recovery Navigators, as well as many other of the programs that Matt and the Department of Mental Health team have shared, just so that we can make sure that that they know how to get connected to our folks to assist in those times when treatment is being sought or needed. Also, you will see links to specific websites that you can go to if someone is needing to access treatment for any substance use related needs. We have a website where you can get a lot of information from there. We have a dedicated mailbox for any referrals, as well as a phone number that can be utilized as well to get in touch with our team. And then I just want to make sure to mention briefly that we have the AmeriGroup. We refer to this as the B-Smart program, but it is the buprenorphine enhanced and supported medication assisted recovery and treatment program. Say that really fast. All three of the MCOs have that benefit, and you can find that program description and how to access those in-network providers for AmeriGroup on the link provided as well. So that is a very high level. I could talk for a lot of time about each of these programs. We have some dedicated outreach and dedicated programs for substance use within our case management program, but that's how you can get in touch with us here at AmeriGroup, as well as some other resources. And with that, I will turn it over to, I think Rhonda is up from Blue Care.
I would say for Blue Care, just ditto everything that Renee said, because our benefits are very similar. We are the same, and a lot of our processes, you will see a link to get into Blue Care. The only thing I'll add, I think, is that we too have a dedicated team of care managers composed of social workers and licensed professional counselors and nutritionists and registered nurses and peer recovery support folks, really there to help folks navigate the healthcare system, because I think any of us who've had to access care realize that the system isn't always the easiest thing to navigate and to understand. And so our team stands ready to help with that. And I just also wanted to call out the great working relationship that the MCOs have with each other. A lot of our processes, we work really hard together to streamline processes to make it less confusing for members who are trying to access care. We have the same sort of arrangement with Redline. We partner with TennCare. We have lots of collaboration. And so we're always grateful for that. And then the other thing I would say is that one of the things we always emphasize is that there's no wrong door to get into treatment. Call the Blue Care number, call one of the other MCO numbers if you have coverage from another plan. Call the red line. There's no wrong door. We just want to make sure that folks get the treatment that they need. And that's it. I'll turn it over to Elizabeth.
Good afternoon, everyone. Following up, I can only say that my colleagues have covered the wide spectrum of services that all of our MCOs provide our most fragile portion of the population. These folks often struggle with finding the services that are available to them, and we all work very, very hard and provide our staff and remarkably knowledgeable and lived experience folks who can help those individuals navigate what can sometimes be a troubling and complicated network and map of a path to recovery. But I'm going to see if I can maybe share a different window. I'm going to share my screen, and I'm going to take a departure rather than just repeating what you have already heard in much more eloquent fashion from some of my peers. And I'm going to talk a little bit about how do we know they need the help, right? So I hope everyone can see my screen. We're going to talk a little bit about something called SBIRT. And that is screening, brief intervention, and referral to treatment. So that acronym, is a substance abuse screening and referral to treatment initiative. It's a patient-centered approach to identifying ways and the use of substances or misuse of substance. It's an education and early intervention tool, and primary care settings, care providers who use SBIRT ask patients about their substance use and discuss use levels and confidentiality with patients. SBIRT services are defined as alcohol and or substance other than tobacco abuse structured assessments. So for example, for anyone who's heard of the audit or the DAST, that's the alcohol use disorders identification test, and the DAST drug abuse screening test. Those are both great screening tools, and in your documentation that you will find, there's going to be some links to some great resources for training, and also a list of different assessments that cover different age ranges and different types of tools that can be implemented within that area. SAMHSA supports research-based comprehensive behavioral health SBIRT models, which follow the 6 characteristics you see on screen. Brevity, it's brief. The initial screening can take 5 to 10 minutes, and the intervention and treatment components indicated by the screening results are completed in significantly less time than just traditional substance abuse treatment, and often refers the person to a more long-term solution. Screening should be universal. Patients, clients, students, and other targeted population are screened as a part of a standard intake process. One or more specific behaviors are targeted. Screening tools address specific behaviors, characteristics deemed to be problematic or preconditional of substance dependence or other diagnoses. SBIRT services occur in the public health setting or non-substance abuse treatment setting. So your emergency departments, your primary care offices, schools, and it's comprehensive and should be a seamless transition between that brief intervention and then treatment itself that may take on up to a lifetime to continue that recovery. And it should be strong research or experimental evidence supported. Now, the good news is it's reimbursable. So these services, these treatment assessments and referrals can be reimbursed. And I've shared some of the codes that are used. These are also on the SAMHSA site. So that link is going to be provided with the information that our Brighter Future folks have collected and put together for everyone. And so those links not only provide these codes as well as more information, but also some training resources, and there will be some links for continuing education credits as well, free. We all love free CEUs. So I have also added on here, this is some of the information that's going to be in your resource documents. You'll see here, you heard Rhonda talk about Be Smart, which is Tennessee's specific buprenorphine program, a very quality-based program, and we are very proud of our state for their efforts in addressing the opioid crisis. We have a direct email for our care management teams to be routed to whichever specialty is needed, and also an 800 toll-free number for accessing the customer service and care management staff. And that concludes my sharing for today, and I sincerely appreciate the time that we were given to actually present to all of you today.
Thank you.
Back to you, Wendy.
Thank you. That was incredible. I think for all of you that live in this world, like a lot of that is, very familiar to you, and maybe can't understand why we all need to hear it. But it's so helpful to have everything laid out there like that for the rest of us that that treat folks that that are in the substance use world, but we're not in that world. So I thank all of you. And they were mentioning these resource pages. I mentioned them. I believe that everything that has been mentioned is on those resource pages, and we will get them out to you very quickly after this meeting.